This is my final presentation. Natalie J. Hauk, HCA 415, Professor Curlin Mani, due December 14, 2014. The significance of community and public health. Public health service is a pearl to our society in that it offers public health and well-being, informing the public as well as empowering the people, giving them the necessities they need in order to achieve optimal health and well-being are also significant to our nation's health. Policies as well as strategic planning with partnerships and help to implement health efforts across the country and further the knowledge and prevention of disease, linking people to the right personnel and giving access to those who need health care are of the utmost importance, not only to ourselves, but to the surrounding communities in our area and abroad. We all have a right to optimal health and well-being. In effort to maintain public health services, it is reliant on its mission, maintaining its very structure, as well as the laws that bind our healthcare system to the public, as well as the stakeholders that fund it. Communications and keeping the transparency are all significant to the growth, efficacy, and innovations and dynamics in this challenging healthcare arena faces today. The role of the community and public health systems and well-being of our population is to ensure protection and prevention of diseases to the mental, physical, and social well-being of our people and the world around us. Agencies like the World Health Organization, Center for Disease Control and Prevention, as well as the Food and Drug Administration work diligently as well as systematically to prevent disease, prolong life, promote health, and efficacy to back up the birthrights of every human being to health and longevity. Public health is maintained by proper assessment, policy developments, and assurance. Each community has a duty to ensure that public health is monitored and maintained through systematic data and whose specificity is narrowed to that specific community, such as diabetes and its relation to the higher prevalence in southern countries and America. The World Health Organization recognizes that health and happiness go hand in hand, so keeping that potential. Understanding the ecology or the relationships between organisms and their environments are essential based on their economic, social, and political affiliations. Public health and organizational structure varies state to state, but somehow all mimic the same protocol when it comes to emergency situations. A study was performed using 47 states and assessing their public health organization structure. The findings concluded that most states have either a state public health agency or state board council of health at the front lines of their organizational structure, in which they have designated state health officials. Other structured healthcare systems include personnel such as physicians, nurses, or assistants, and other organizational structures are long-term care facilities that are inpatient, acute care hospitals, and nursing homes, amongst private practices and ambulatory outpatient facilities. Laws are created to regulate human behavior, while ethics is the way humans' behavior can be described as having set morals that affect good or bad judgments. In other words, ethics is how we as a society uphold those laws to keep them in place and respect each other as well as our government. There are many laws that apply to protect the people in our society that go beyond the Civil Rights Act we have had in place since the birth of our Constitution. In healthcare, there are many applicable laws that protect the physician, the insurance companies, and most importantly, the patient from harm or criminal abuse. These laws are known as tort laws, which protect the patients from negligence as well as malpractice, while establishing guidelines that also protect the physician and the hospital from being sued unnecessarily. There is also the HIPAA laws that protect patients' medical records and releasing them accordingly to those persons or entities designated by the patient. There are also criminal laws that protect insurance companies from providers who bill fraudulently and claim dues undeservingly. These laws protect and create guidelines for all those above mentioned involved, and those who uphold these laws and keep an honest, ethical business are those who respect the government and the people they care for and serve. Legal and ethical dimensions include the microsystems as well as the macrosystems associated with healthcare. Laws and policies in place for public and community health services include the manner in which the public health system and communities respond to emergency situations such as bioterrorism attacks, which involves the use of biological warfare to harm the public in mass casualties such as anthrax or ricin. Detection, containment, and treatment are essential bullet points to address when dealing with this type of emergency situation, where mass casualties can be expected and spread from person to person and state to state. Detecting the issue, the whereabouts, and training specialized personnel is critical to maintaining the commitment to the public to protect them and to prevent further spreading of any disease. Containing the disease as quarantine can be trying, as the rights of those citizens involved or affected can be tried, and where those rights must be respected, such as monitoring people in and out of New York airports in the Ebola crisis of 2014. Treatment must always be established with the patient, as it is stated in the Bill of Rights, and autonomous individuals have the choice to make sound decisions regarding their bodies as it is theirs. Refusing treatment of any kind, whether one needs it or not, is in the patient's discretion. Public and community health services are funded by various systems. Some of those systems include taxpayers' dollars, Medicare, Medicaid, Child Health Plus, state health insurance plan, and even workers' compensation. Government payers such as federal and state are also involved in funding of the programs and healthcare services offered to the public and the community. Many facilities operate either by a for-profit or not-for-profit means, but also private benefactors and small philanthropies have also taken a great interest in community and public health services. Funding is not only important, but relies on these structures for its subsistence. Community and public health rely on effective communications amongst all involved in the healthcare system. Whether you are a patient or a stakeholder of an organization or just interested in learning about community and public health safety, it is essential for communication, especially interpersonal communication, to exist among these elements. Transparency is key to understanding the truth behind all different diseases, the preparedness and epidemiology behind them, as well as the existence within their communities. Special populations such as Latinos might want to know that they are of a higher risk for diabetes type 2 than others and may want to seek medical attention to see if they are in fact the candidate or have the disease. Awareness is also important, as it is the information received about certain flu strains or viruses lurking within or outside the country, such as Ebola, which was tracked from the moment it struck here in New York. Educating the public and keeping all involved in communities are essential to the public health and well-being. Reducing panic is critical where the catastrophes exist, and effective communication is key to keeping the public calm and under control. Enhancing surveillance as well as the disease management amongst healthcare entities and public are significant to the control over the disease, as well as ensuring effectiveness in training and the management of healthcare staff involved in patient care urgency. This concludes my final presentation. Thank you and have a wonderful evening. Good night.